Schizophrenia is a complex mental illness that affects millions of people worldwide. It is a condition that can be challenging to understand, both for those who have it and for those around them. It affects how a person thinks, feels, and behaves, often leading to a significant impact on their daily life and relationships. The symptoms can vary widely from person to person, making each case unique. People with schizophrenia may seem like they have lost touch with reality, experiencing hallucinations, delusions, and disorganized thinking. These symptoms can be frightening and confusing, not only for the individual, but also for their loved ones. This can be distressing for them and their loved ones, creating a ripple effect of emotional and psychological strain within families and communities. Support and understanding from those around them are crucial. Schizophrenia is a chronic condition, meaning it lasts for a long time, often requiring lifelong management. Treatment typically involves a combination of medication, therapy, and support from healthcare professionals. However, with proper treatment and support, individuals with schizophrenia can live meaningful and fulfilling lives. Schizophrenia is often misunderstood, leading to misconceptions and myths about the condition. This lack of understanding can lead to fear, prejudice, and discrimination, further isolating those with the condition. It's important to educate ourselves and others to break down these barriers. It is crucial to remember that people with schizophrenia are just like anyone else, with hopes, dreams, and the potential to contribute positively to society. They deserve the same compassion, respect, and support as anyone else. They deserve compassion, respect, and support. Support groups and community resources can play a vital role in providing the necessary assistance and creating a network of understanding and empathy. This essay aims to provide a comprehensive overview of schizophrenia, shedding light on its complexities and the experiences of those who live with it. We will explore its symptoms, causes, and treatment options, delving into the latest research and advancements in the field. Understanding the root causes can help in developing more effective treatments and support systems. We will also discuss the challenges and triumphs of living with this condition and emphasize the importance of reducing stigma and promoting understanding. Personal stories and experiences can provide valuable insights and foster empathy. By shedding light on schizophrenia, we can foster a more informed and compassionate society. Awareness campaigns and educational programs can make a significant difference in changing perceptions and attitudes. This will help individuals with schizophrenia and their families navigate the complexities of this illness and live full and meaningful lives. Together, we can create a world where mental health is understood, accepted, and supported. Schizophrenia manifests in a variety of ways, affecting individuals differently and often unpredictably. Its symptoms are often categorized into three groups: positive, negative, and cognitive, each presenting unique challenges and requiring different approaches for management. Positive symptoms are those that are added to a person's normal experiences, creating distortions in perception and thought. On the other hand, negative symptoms represent a diminishment of typical emotional responses or behaviors, leading to a significant reduction in one's ability to function. Cognitive symptoms affect a person's thinking and information processing, often making everyday tasks seem insurmountable. Positive symptoms are perhaps the most widely recognized and can include hallucinations and delusions, which are often the most alarming to both the individual and those around them. Hallucinations are sensory experiences that are not real, such as hearing voices, seeing things that aren't there, or feeling sensations on the skin without a physical cause. These experiences can be incredibly vivid and convincing, making it difficult for the person to distinguish them from reality. Delusions are firmly held beliefs that are not based in reality, such as believing that one is being followed, spied on, or that one has special powers or importance. These delusions can lead to significant distress and can sometimes result in dangerous behaviors. Negative symptoms are less dramatic than positive symptoms, but can be equally debilitating. They often go unnoticed or are misunderstood as laziness or lack of interest. These include reduced emotional expression, social withdrawal, lack of motivation, and difficulty experiencing pleasure. Individuals may find it hard to engage in daily activities or maintain relationships. Individuals with negative symptoms may appear apathetic, withdrawn, and uninterested in activities they once enjoyed. This can lead to isolation and a decrease in quality of life. Cognitive symptoms often precede the onset of positive and negative symptoms and can persist even when other symptoms are well managed. These symptoms can be subtle but have a profound impact on daily functioning. These symptoms can include problems with memory, attention, concentration, and executive functioning. Things like planning, organizing, and decision-making. These cognitive deficits can make it difficult to perform tasks that require mental effort and can affect academic and occupational performance. These cognitive challenges can significantly impact an individual's ability to function in daily life, work, or school. They may struggle to keep up with responsibilities, leading to frustration and a sense of helplessness. Understanding and addressing these symptoms is crucial for providing comprehensive care and support to individuals with schizophrenia. While the exact causes of schizophrenia are still being researched, a complex interplay of genetic, environmental, and neurobiological factors is believed to contribute to its development. Scientists are delving deep into the human genome to identify specific genes that may be linked to the disorder. This research is crucial as it helps us understand the hereditary nature of schizophrenia and how it can be passed down through generations. Family history plays a significant role, as having a close relative with schizophrenia increases an individual's risk. Studies have shown that if one parent has schizophrenia, the risk for their child is about 10%, compared to the general population risk of about 1%. This highlights the importance of genetic predisposition in the development of the disorder. However, genetics alone cannot fully explain the occurrence of schizophrenia, as many individuals with a family history of the illness never develop it, while others with no known family history do. This indicates that other factors must be at play, interacting with genetic predispositions to trigger the onset of the disorder. This suggests that environmental factors also play a crucial role. The environment in which a person grows up and lives can significantly impact their mental health. Factors such as socioeconomic status, urban upbringing, and exposure to stressful life events can all contribute to the risk of developing schizophrenia. Exposure to certain viruses during pregnancy or early childhood, complications during birth, and childhood trauma have been linked to an increased risk of developing schizophrenia later in life. For instance, prenatal exposure to infections like influenza or malnutrition can disrupt brain development, making an individual more susceptible to the disorder. Substance abuse, particularly marijuana use during adolescence, has also been identified as a potential risk factor. Adolescence is a critical period for brain development, and the use of substances like marijuana can interfere with this process, potentially leading to the onset of schizophrenia in vulnerable individuals. Furthermore, research has shown that imbalances in brain chemistry are involved in schizophrenia. Neurotransmitters, the chemicals that transmit signals in the brain, play a crucial role in regulating mood, thought processes, and behavior. Dopamine, a neurotransmitter associated with pleasure, motivation, and movement, is found in higher levels in the brains of individuals with schizophrenia. This overactivity of dopamine pathways is thought to contribute to the hallucinations and delusions commonly experienced by those with the disorder. Other neurotransmitters, such as glutamate and serotonin, are also believed to play a role in the development and manifestation of the illness. Glutamate is involved in cognitive functions like learning and memory, while serotonin helps regulate mood and anxiety. Imbalances in these neurotransmitters can disrupt normal brain function, leading to the symptoms observed in schizophrenia. Ongoing research aims to better understand these chemical imbalances and develop more effective treatments for those affected by this complex disorder. Diagnosing schizophrenia is a multifaceted process that involves a comprehensive psychiatric evaluation, a thorough medical history review, and often ruling out other conditions that may present with similar symptoms. There is no single test to diagnose schizophrenia, and clinicians rely on a combination of clinical observations, interviews with the individual and their family members, and sometimes psychological testing. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, published by the American Psychiatric Association, provides criteria for diagnosing schizophrenia. These criteria include the presence of at least 2 of the following symptoms for a significant portion of time during a 1-month period: delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. Differential diagnosis is a crucial aspect of identifying schizophrenia, as many other conditions such as bipolar disorder, severe depression with psychotic features, and substance-induced psychosis can mimic its symptoms. It is essential to distinguish between these conditions to ensure that individuals receive the most appropriate and effective treatment.